It is a typical day in the emergency room at Providence Willamette Falls Medical Center, a hospital with deep roots in a close-knit community, but one that is feeling the pressures of serving the needs of uninsured patients, many who end up here at the emergency department because they cannot afford regular care.
There's a lot of people that spend a lot of time in the emergency rooms these days that really should have been in an office.
Pam Carpenter, a 33-year veteran nurse of the hospital, sees it every day.
We've gone to 50%, and I may stretch it to 60 to 65% of people coming in that are not covered by insurance or have low-income insurance.
An issue that affects the well-being of the community, not only financially, but also physically.
What's happened is that they've got a chronic illness that really needs regular treatment, and unfortunately they have no place to go. So what they try to do is they try to use the emergency department in contrast to going to a regular primary care physician.
Doctors Frank Bennett and Bill Perch remember a different situation when they, along with 6 other physicians, founded Willamette Falls Hospital in 1959. The small town's mill workers and their families were covered by a prepaid health plan.
They were not afraid to seek out and get medical care.
But the doctors also remember the hundreds of patients who were not covered and say even in those days, the local medical community treated everyone.
The medical community took care of people's needs, whether they had insurance or not.
Whether it was then or now, they also recognize the importance of coverage.
There are an awful lot of people that don't have any insurance, and because of that, their care is neglected or delayed, and in some instances may cause premature deaths.
1 in 7 people in Clackamas County are currently without health insurance. In addition to the uninsured, another 299,000 Oregonians have experienced a health insurance coverage gap at some time during the past 12 months.
Those patients end up in the emergency department, end up in emergency surgery, end up in an inpatient stay, and the charges go from what would normally be maybe a $100 visit every few months to now $40,000, $50,000, $100,000.
Even though the hospital offers $3.6 million in charity care each year, some patients are reluctant to accept it.
Not everybody feels comfortable filling out paperwork that says, hey, I need some kind of financial assistance.
These staggering figures are very real in our own backyard and growing.
Everybody should have access to medical care. And the fact that you don't have insurance and don't have coverage is no excuse.
Providence Willamette Falls Medical Foundation is working to address these issues through the Founders Clinic initiative. This clinic will fill a void that's compromising the health of patients and the health of the entire community.
When they've lost their jobs, they've lost their insurance, and they're forced to bring their problems to the emergency room knowing that they're creating a bill and are unable to fill it, I think sometimes they might stay home when they're chronically ill because they don't want that. So I think a free clinic, if they knew that they could come and get the help they needed and there wouldn't be that financial tie, I think it would be a great thing.
Help us to make this vision a reality with a gift to the Founders Clinic and honor the legacy of community care that Dr. Bennett, Dr. Perch, and the other 6 founding physicians established when they opened this hospital 50 years ago.
It would certainly take care of some of the basic needs that people who do not have health insurance.
Start with a free clinic, but it has to have support.